Hello, welcome you all for the next previous question discussion. So the next question was regarding carpal tunnel syndrome. So in carpal tunnel syndrome, they have they have some options which is features of the carpal tunnel syndrome. So in that one feature, it is not comes under the symptom of carpal tunnel syndrome. So that they have asked. So carpal tunnel syndrome, first of all, we have to know there is a compression happening in the median nerve. Okay, so it is a median nerve entrapment. Okay, carpal tunnel syndrome means there is a compression over the median nerve is happening, and the median nerve is supplying into the thumb, index finger, middle finger, and half of the ring finger. Okay, not little finger, ring finger. So these are the fingers were supplied by the median nerve. You can see the red markings are there, no? So that much area is supplied by the median nerve. Okay, thumb, index finger, middle finger, and half of the ring finger, this much area is supplied by the median nerve. If any compression is happening in the median nerve, it leads to the pain, paresthesia, numbness in these region. Okay, thumb, index finger, middle finger, half of the ring finger, this much area the patient will be suffering with the paresthesia, pain, numbness, tingling sensation. This type of symptoms will be generated in the carpal tunnel syndrome. What are the reasons for getting this compression? So for that they have the reasons are, you can see there is a mnemonic they have written, median nerve trapped. Okay, so median, that is the median and the trap. Okay, these are the capital letters. So with that you can identify the causative factors. M stands for myxedema. Okay, myxedema, it is a complication of hypothyroidism. So those who are suffering with the hypothyroidism, they will be getting a complication myxedema, which means the swelling all over the body. Okay, then due to that reason you can get carpal tunnel syndrome. Due to the edema you can get, and the D stands for diabetes mellitus. So those who are suffering with the diabetes mellitus, they can get carpal tunnel syndrome. I stands for idiopathic and A stands for acromegaly. Okay, acromegaly is a growth hormone secretion, increased growth hormone secretion. Due to that you will be getting overgrowth of the body, that is called acromegaly. Okay, in that case also you will be getting carpal tunnel syndrome. And N stands for neoplasm. Okay, like ganglion cyst or lipoma. Okay, so such type of tumor cyst condition also, if that is happening near to the carpal tunnel area, then you will be getting median nerve compression, and through that way you will be getting carpal tunnel syndrome. And T stands for trauma, R stands for rheumatoid arthritis. So those who are suffering with the rheumatoid arthritis, they can get carpal tunnel syndrome. A stands for amyloidosis. Amyloidosis is a abnormal protein, amyloid. Okay, so such type of an abnormal protein is there. If that is getting deposited in the carpal tunnel, and because of that you can get median nerve compression, and it result in the carpal tunnel syndrome. And another one is pregnancy. Okay, so these are the reasons for getting compression of the median nerve, and because of the compression the patient will be suffering with the pain, paresthesia, numbness in the thumb, index finger, middle finger, half of the ring finger. Okay, so this is called as carpal tunnel syndrome. So it is a median nerve compression. Okay, so what are the investigation, like what are the tests we can do for identifying the carpal tunnel syndrome? That is Fallon test, Tinel test, and Durkheim test. Okay, so Fallon test means, you can see here in the picture they have shown that the wrist joints are flexed and they are attached together. Okay, wrist is flexed to maximum up to 1 minute. Okay, you have to do the flexion like this, both the joints. Okay, keep it for 1 minute. So while keeping it, what happen if the patient is suffering with the carpal tunnel syndrome? So in the thumb, index finger, middle finger, that much area, suddenly the patient will be getting pain, paresthesia, numbness, or such type of symptoms they will be generating. Then we can tell that Fallon's test is positive. Another one is Tinel sign. So Tinel sign means you will be tapping over the wrist joint, okay, where the median nerve is passing. No, so that area, if you just tap it, you can see if carpal tunnel syndrome is there, then the patient will be getting pain, paresthesia, numbness in the thumb, index finger, middle finger, half of the ring finger. That much area, if you are getting suddenly there is a numbness, all those things, then we can confirm patient is suffering with the carpal tunnel syndrome. Next, another test is Durkheim test. Okay, Durkheim test means you will be applying directly pressure to the carpal tunnel. You can see there is a physician is pressing the base of the thumb area. Okay, where the median nerve is passing, there the doctor will be applying some direct pressure for 1 minute. If patient is suffering with the carpal tunnel syndrome, then you will be getting numbness and paresthesia in the thumb, index finger, middle finger. Okay, then we can confirm patient is suffering with the carpal tunnel syndrome. Okay, so the question was, in carpal tunnel syndrome, what was the feature which is not present? Okay, so ulnar nerve, that is the except one reason, because carpal tunnel syndrome is a median nerve compression condition, and if ulnar nerve compression, that condition is called cubital tunnel syndrome. Okay, so Tinel sign, Fallon sign, these all those things you can see in carpal tunnel syndrome. Okay, ulnar nerve compression you can see in cubital tunnel syndrome. So the answer was ulnar nerve. Okay, so carpal tunnel syndrome means it is a median nerve compression, and the compression is result because of the myxedema, edema, diabetes mellitus, idiopathic, acromegaly, neoplasm, trauma, rheumatoid arthritis, amyloidosis, pregnancy. So these are the reasons for getting median nerve compression, and median nerve is supplying in the thumb, index finger, middle finger, half of the ring finger. This much area is distributed by the median nerve. Because of the compression in the median nerve, that much area the patient will be suffering with the pain, paresthesia, numbness, tingling sensation. Okay, for identifying the carpal tunnel syndrome, three tests you can do: Fallon test, Tinel test, and Durkheim test. Okay, and gold standard investigation for identifying carpal tunnel syndrome is nerve conduction study. Okay, so these are the main things related with the carpal tunnel syndrome. Then next question. Jaw pain while chewing. Okay, while chewing there will be severe pain in the jaw area, and along with that loss of vision they have told. So these symptoms are indicating patient is suffering with the temporal arthritis. Okay. So temporal arthritis, or otherwise known as giant cell arthritis, or otherwise known as Horton disease. Okay, so temporal arthritis means it is a inflammation of the blood vessel. Okay, inflammation of the blood vessel. Which blood vessel? Temporal artery. Okay, so inflammation of the temporal artery, that is called as temporal arthritis, or otherwise known as giant cell arthritis. Okay, temporal arteries, that is supplying near the temple area. You can see in that picture. Okay, the temporal area, this supplied by temporal artery. Okay, so it is supplying from in the scalp area, jaw muscles, and eye region. Temporal artery, they are supplying the blood vessels for the scalp, jaw muscles, and the eye region. These are supplied by the temporal artery. In the eye region, optic nerve. Okay, so temporal artery, they are supplying the regions are scalp region, jaw muscles, and in the eye they are supplying the blood vessel to the optic nerve. Okay, through or nutrition is given to the optic nerve. So because of this inflammation, what happened? It result in the vision loss, and there will be neck or jaw pain will be there. Okay, and this temporal artery, it is a branch of the external carotid artery. Okay, so because of the inflammation happening in the temporal artery, so the patient will be getting sudden vision loss, and there will be neck or jaw pain you can see. And this temporal arthritis, it is commonly associated with the polymyalgia rheumatica. Okay, usually this condition you can see those who are suffering with the polymyalgia rheumatica. So polymyalgia rheumatica means you will be getting severe muscle pain, stiffness. Okay, so that is called as polymyalgia rheumatica. In different muscles, suddenly you will be getting pain and stiffness. Okay, especially in the neck, shoulder, upper arm, hip, thigh and buttocks. Okay, neck, shoulder, upper arm, hip, thigh region, buttocks. So these are the areas you will be getting sudden onset of pain and stiffness. So this condition is called polymyalgia rheumatica, and that is usually affecting after the age of 50-year aged people. They used to get severe this condition, polymyalgia rheumatica. So severe pain and stiffness will be getting in these upper arm, thigh region, back area. Okay, so these areas you will be getting severe pain and stiffness, and usually you will be getting this pain and stiffness more in the morning time. Okay, morning time you will be getting severe pain and stiffness. Okay, so those who are suffering with the polymyalgia rheumatica, they used to get temporal arthritis. So symptoms of the temporal arthritis, there will be headache will be there. Okay, continuous headache in the forehead area, continuous headache, fatigue. Okay, fatigue, fever, weight loss. So that is symptoms of the inflammation. So inflammatory changes, because of the inflammatory changes you will be getting fatigue, fever, weight loss, and the temporal artery is affected. So you will be getting jaw pain, especially after chewing the jaw pain will be increasing. Okay, and tenderness in the scalp area. Okay, and it is affecting the optic nerve. So you will be getting double vision, loss of vision. Okay, so these are the symptoms of the temporal arthritis. So it is an inflammation of the temporal artery. Temporal artery is a branch of the external carotid artery. Temporal artery is supplying the scalp, optic nerve and the jaw area. So because of the inflammation is happening in the temporal artery, so you will be getting fatigue, fever, jaw pain while chewing, tenderness in the scalp area, continuous headache will be there for one side or otherwise both the side you will be getting. Vision, if it is affecting the optic nerve, so you will be getting double vision and loss of vision will be there. Okay, and this condition is usually associated with the polymyalgia rheumatica, and the complication is aortic aneurysm, stroke and blindness. So these are the complications of the temporal arthritis. Then investigations are, you can do the blood test. In the blood count, because of the inflammation you will be getting increased ESR will be there, increased C reactive protein will be there, and there will be anemia you can see. Okay, then for gold standard investigation for identifying temporal arthritis is temporal artery biopsy. Okay, temporal artery biopsy is the gold standard investigation for identifying the temporal arthritis. Next one is TOFI location except, they have asked. Okay, so TOFI means increased deposition of monosodium urate crystals. Okay, TOFI means monosodium urate crystals, that is called as TOFI. So in which all the locations we used to get the TOFI? That is in the helix of the ear, olecranon bursa, ulnar of the forearm, wrist joint, finger pad, knee joint, Achilles tendon. So these are the common locations where the TOFI used to occur. So synovial membrane, in that area you don't see the TOFI. The answer for that question is synovial membrane. Okay, so these are the common locations where the TOFI used to occur. So TOFI means it is a deposition of the monosodium urate crystal. Next question was, a female engineer, she is 12 to 14 hours she is working and eating mainly junk foods. There is no fruits and vegetables. Okay, HB is decreased. HB decreased means hemoglobin is decreased means patient is suffering with the anemia. And increased MCV. Increased MCV means mean corpuscular volume. Okay, normal mean corpuscular volume measurement is 80 to 100. Okay, 85 to 100, 80 or 85. Okay, till 100, that is the normal mean corpuscular volume. Mean corpuscular volume means the size of the RBC cell, we can call it as mean corpuscular volume. Okay, so the size of the RBC cell we have to see. Okay, so if we are checking the size of the RBC cells, if you are getting 80 80 to 100, okay, or 85 to 100, that much in between that range if you are getting MCV, which means the patient is suffering with a normocytic anemia. Okay, patient is having anemia, but the size of the RBC cell is in normal shape. Okay, in case MCV is more than 100 if you are getting, which means the patient is suffering with a macrocytic anemia. Okay, so MCV means mean corpuscular volume, which is indicating the size of the RBC cell. Okay, so if it is checking the MCV, if it is more than 100 if you are getting, which means the patient is suffering with a macrocytic anemia. Okay, if it is less than 80 if you are getting MCV value, which means microcytic anemia. Okay, so which all the conditions you will be getting this normocytic, microcytic and macrocytic anemia. If you check the MCV, through that way we can easily identify what is the reason for getting anemia. Okay, so if the patient is having anemia plus normal RBC cell, okay, normal MCV if you are getting, which means the patient is suffering with a normocytic anemia. In which all the conditions you can see normocytic anemia? Anemia of chronic disease, chronic kidney disease, aplastic anemia, hemolytic anemia, acute blood loss. In these conditions you will be getting normocytic anemia. Okay, so these conditions will be causing the iron deficiency, and because of that you will be getting the proper RBC cell is not forming. Okay, so shape they don't have any problem. Normal RBC cell is forming, but the RBC cell is not, like, because of the deficiency of the iron, because of that reason you are not getting the RBC production. That is the main thing. Okay, so in normocytic anemia, normal RBC cell size is there. Because of the less production of RBC cell, you are suffering with the anemia. So, anemia of chronic disease, chronic kidney disease, aplastic anemia, hemolytic anemia, acute blood loss. In all these cases, you are getting less production of RBC cells, but they will be having normal size of RBC. Okay, next one is microcytic anemia. Microcytic anemia means mean corpuscular cell volume is less than 80. Okay, MCV is less than 80, which is indicating patient is suffering with a microcytic anemia. In which all the conditions you can see iron deficiency anemia. That is an important one. So those who are suffering with the iron deficiency anemia, they will be getting microcytic anemia. Then thalassemia, congenital sideroblastic anemia, anemia of chronic disease, lead poisoning. Okay, so in these conditions you will be getting microcytic anemia. In anemia of chronic disease, usually normocytic, normochromic anemia, so that is only you will be getting, but sometimes you can get microcytic. Okay, that is an exceptional case. Okay, so microcytic anemia means you are having less production of RBC cells, at the same time the shape of the RBC cell is very less in structure. Okay, shape of the RBC cell is very less. Okay, that is called as microcytic anemia. So this type of anemia, in which all the conditions you can see iron deficiency, thalassemia, congenital sideroblastic, anemia of chronic disease and lead poisoning. So these are the condition which is causing microcytic anemia. Next one is macrocytic anemia, which means MCV is more than 100. If MCV is more than 100, which means the patient is suffering with the macrocytic anemia. Okay, it is of two types are there, megaloblastic and normoblastic. Normoblastic anemia means where the normoblast means immature RBC. Okay, immature RBC, that is called normoblast. So that appears in the blood. Okay, MCV is more than 100 plus normoblast is present in the blood circulation, then that is called as normoblastic anemia. Okay, so that is usually seen in the case of alcohol. Those who are dependents, alcohol dependents, those who are suffering with the liver disease, those who are suffering with the hypothyroidism, reticulocytosis, myelodysplasia and drugs intake of cytotoxic. So this type of those who are having this type of disorders, or those who are taking cytotoxic drugs, because of these reason, what happen, normoblast will be appear in the blood circulation, plus the cell size is also increased. Okay, more than 100 cell size you can see, then that is called as macrocytic anemia in that normoblastic category. Okay, normoblastic macrocytic anemia. Okay, normoblastic macrocytic anemia means MCV is more than 100, plus normoblast, immature RBC cells you can see in the blood circulation, that is called as normoblastic macrocytic anemia. Usually you can see in the alcohol, liver disease, hypothyroidism, pregnancy, reticulocytosis, myelodysplasia. Okay, and the drugs like cytotoxic. Okay, in megaloblastic, what happen? You will be getting abnormally large RBC cell. Okay, in megaloblastic macrocytic anemia means you are getting abnormally large RBC cell, that is called as megaloblastic macrocytic anemia. In normoblastic, you will be getting normoblast. Okay, plus increased RBC cell. Like whatever the normoblast which has happened in the blood, that will be having increased size. Okay, in megaloblastic you will be getting proper RBC cell, but whatever the RBC cell is formed, that will be having increased size. Okay, that is the difference between these two conditions. In normoblastic, you will be getting normoblast, immature RBC cells are found. In megaloblastic, you will be getting mature RBC cell, but the size of the RBC cell is increased. That is called megaloblastic. So that is usually happen in two conditions only: vitamin B12 deficiency and folate deficiency. Okay, in these two conditions you will be getting megaloblastic anemia. Okay, vitamin B12 and folate deficiency. Vitamin B12 is cyanocobalamin. Okay, these two are the main reason for getting megaloblastic macrocytic anemia. So here the question was increased MCV, which means patient is suffering with the macrocytic anemia, and they have not mentioned about the normoblast. So you have to think about vitamin B12 and folate deficiency. Okay, so these two options you can get it. Okay, and here mainly they are telling eating mainly junk foods, no fruits and vegetables. Okay, that especially they are telling. Inadequate diet they are telling. So because of the inadequate diet, you will be getting vitamin B12 deficiency anemia. Vitamin B12 deficiency you can get in the inadequate diet. Okay, and vegetarianism. So those who are taking leafy vegetables or vegetables only, if they are not taking any milk, egg. Okay, so that type of things if they are not taking, mainly they will be getting vitamin B12 deficiency. So in this question they have mentioned about only junk foods they are eating. So it is an inadequate diet. So the patient will be suffering with the vitamin B12 deficiency. Okay, and vitamin B12 deficiency you can see in other conditions like intrinsic factor deficiency. Okay, intrinsic factor means it is that you can get it in the intestine. Okay, it is secreted by the intestine. With the help of intrinsic factor only, vitamin B12 absorption will be happening from the small intestine. Okay. So intrinsic factor, it is produced by the parietal cells in the stomach. Okay, so if you have a problem in the stomach, so because of that intrinsic factor is not producing, then vitamin B12 absorption will not happen. So intrinsic factor deficiency, it can lead to vitamin B12 deficiency. Okay, like pernicious anemia, gastrectomy, in all these conditions there is a defect is happening in the parietal cells, and because of that you will be getting intrinsic factor deficiency, and because of that you can get vitamin B12 deficiency anemia. Okay, and if you are suffering with the malabsorption, okay, malabsorption condition, then ileal resection, ileitis. Okay, from the ileum region also vitamin B12 absorption will be happening. If you have a problem in the ileum, that also can lead to vitamin B12 deficiency. Bacterial overgrowth. Okay, that also will lead to vitamin B12 deficiency. So these are the reasons where you can find the vitamin B12 deficiency: inadequate diet, vegetarian food, and intrinsic factor deficiency, malabsorption, ileal resection, bacterial overgrowth. Okay, then folic acid deficiency you can see in the inadequate diet, alcoholism. This is an important. So it's if a patient is an alcohol, then you have to think about folic acid deficiency. Then in alcohol, another vitamin deficiency is there, that is thiamine, vitamin B1. Okay, so in the question, if it is an alcoholic patient who is suffering with anemia, then you have to think about two things. First one is vitamin B1 deficiency or thiamine, and another one is folate deficiency. Okay, so these two deficiencies you can see in the alcoholic patient and then infants. Okay, so these are the main important things regarding with the folic acid deficiency. Then impaired absorption, malabsorption, intrinsic intestinal disease. Okay, then pregnancy people. Okay, so these are the main people where it will be affecting with the folic acid deficiency: alcoholism, infants, pregnancy. Okay, so here in this question they have written like it is inadequate diet and suffering with the fatigue and paleness. So fatigue is indicating vitamin B12 deficiency. Okay, so here the question was anemia plus increased MCV. So macrocytic anemia. So macrocytic anemia you can see in the vitamin B12 and folate deficiency. Here eating mainly junk food they are telling. So mainly it is focusing into the vitamin B12 deficiency anemia. Okay, so the answer will be vitamin B12 deficiency anemia. And in vitamin B12 deficiency anemia you will be getting neurological symptoms also: pain, paresthesia. Okay, so such type of neurological symptoms also you can see in the vitamin B12 deficiency anemia, because vitamin B12 helps in the neurological functions. Okay, if you have a deficiency in vitamin B12, it can result in the neurological symptoms. So that also you should know. In folate deficiency you don't get that much neurological symptoms. Okay, anemia plus neurological symptoms they are mentioning. Always think about vitamin B12 deficiency. Next question was: a swelling in the midline neck region leads to the protrusion of the tongue. So that is usually seen in the thyroglossal duct cyst. So it is a cyst which is forms in the thyroglossal duct. Okay, it is a fibrous cyst which is forms in the thyroglossal duct. Okay, and if the thyroglossal duct is present in the front part of the neck region, so there if you are getting a cyst formation, you can see there will be you can see in the picture there is a swelling in the neck region, a mass you can see. Okay, a mass you can see in the neck region. Okay, that is the thyroglossal duct cyst, and the main important symptom is they will be moving whenever we are protruding the tongue, whenever we are moving the tongue. So that time the mass will be moving, you can see. So that is an important diagnostic feature for identifying the thyroglossal duct cyst. Okay, and the main investigation is thyroid scintigraphy and ultrasound. Next question was difficulty in swallowing due to the dysfunction of the throat and esophagus. That condition is called dysphagia. Okay, difficulty in swallowing because of the problem of the throat and esophagus. That condition is called dysphagia. So due to oropharyngeal, which means throat area. Okay, because of that problem you can get dysphagia. Due to the esophagus problem also you can get dysphagia. Okay. So if it is a oropharyngeal problem, two reasons are there. Due to the structural problem. Okay, structural problem of the throat region, because of that you can get dysphagia. So example for that is tumor. Okay, if a tumor is present in the tongue and tonsil, because of that reason you can get difficulty in swallowing. Okay, then neurological problems of the oropharyngeal. Okay, like stroke, Parkinson, motor neuron disease. Because of these nervous system disorder, impulse transmission will not be happening in the throat area. So because of that, what happened, that swallowing impulse they don't get it. Okay, the neurons will not be working properly. So what happened, the tongue will not be helping for the swallowing. Okay, so due to the problem of the throat, two reasons you can get: due to the structural problem you can get, due to the neurological problem. Structural problem example is tumor. Okay, because of the tumor, there is a presence of the tumor, you can get difficulty in swallowing. Neurological problems like stroke, Parkinson, motor neuron disease, because of the throat region will not be getting the proper impulse, and because of that swallowing will not be happening. Okay, so because of these reasons you can get difficulty in swallowing. Next one is esophageal. Okay, because of the problem of the esophagus you can get difficulty in swallowing. Okay, yeah, esophagus structural problem is also there, neurological problem is also there. So structural problem because of the carcinoma, because of the esophageal stricture, because of the presence of the foreign body in the esophagus, because of the mediastinal mass. Okay, because of these reasons you can get difficulty in swallowing. Because of the neurological problem also you can get difficulty in swallowing. What are the neurological problems which is affecting the esophagus is achalasia, scleroderma and nutcracker. Okay, so these are the neurological problems which is affecting the esophagus, and through that way the patient will be getting difficulty in swallowing. So that is called dysphagia. Okay, so difficulty in swallowing due to the dysfunction of the throat and esophagus. So the condition is dysphagia. Next one was test to detect rotavirus. Okay, so rotavirus means it is a contagious virus that is usually causing gastroenteritis, which means inflammation of the stomach and intestine. Okay, so it is a rotavirus means it is a contagious virus. They will be producing gastroenteritis. Okay, so how it is entering into the body? Usually it is affecting the children. Okay, especially it used to affect the children. Okay, infants and young children. These are the two categories where you can see the rotavirus is getting infected. Okay, so you will be getting severe watery diarrhea, vomiting, fever, abdominal pain. These are the symptoms of the rotavirus. How it is entering into the children, that is fecal oral route. Okay, in the stools you can see the rotavirus, and if you are not properly hand washing, then it can enter into the hands, and through the usage you can see the children will be playing, no? So if they are not washing the hands properly, so in the hands that virus will be there, so they will be touching the toys, or they will be hand in hand they will be holding. Okay, through that way it will be spread to the other children, and it will be affecting the other children also. Okay, so through the hand is not washing properly, so and through the contaminated surfaces, this will be spreading to the other children. So the rotavirus spreading to the other infants and other young children. So rotavirus usually you can get this thing in the nurseries. Okay, so it's a preschool children, suddenly he has got a severe diarrhea, and in the history they will be telling in that preschool also 2-3 children also affected this type of same symptoms. Like that they are telling in the history, always think about rotavirus. Okay, so rotavirus, they will be causing gastroenteritis. So the main symptoms is severe watery diarrhea, vomiting, fever, abdominal pain. How it is entering into the children, that is fecal oral route. Okay, so through the contaminated hand, surface, and the through the fecal matter. Okay, so through this way the rotavirus will be spreading to the other children. Okay, and if it is not treated properly, because of the severe diarrhea, it can result in the dehydration, and it leads to the death of the child. Okay, so preventing the rotavirus, nowadays rotavirus vaccine is present. Okay, rotavirus vaccine is there. Through that way we can avoid the rotavirus. Okay, so how we can diagnose is through the stool examination. Okay, stool sample you can just check it through the electromagnetic, through the electron microscopy. Okay, stool sample, if you do the electron microscopy, through that way you can identify the rotavirus infection. So rotavirus test from the stool specimen you have to do for detecting the rotavirus, usually affecting the infant and young children. Okay, usually this is getting from the nursery preschool area. Okay, main symptom is severe watery diarrhea, vomiting. Okay, so these are the main things regarding with the rotavirus. Next questions we will discuss in the next video.